Hey, this is Mason Haley with Wahpeton Family Dentistry. Our goal is to take the fear out of dentistry and help patients make informed decisions about their oral health. Does whitening ruin your enamel? This question usually comes with a little fear behind it. A patient says, I want whiter teeth, but I do not want to sand my teeth down to dust. Fair concern. Nobody wants teeth that look great for 3 weeks and then need a tiny hard hat and a safety vest. Here's the short answer. Whitening does not have to ruin enamel when it's done the right way, with the right product and the right person. But whitening can cause problems if overused, used wrong, used on unhealthy teeth, or used with harsh do-it-yourself methods. So, in this episode, we will talk about what enamel is, how whitening works, why sensitivity happens, what can go wrong, what whitening can and cannot fix, and how to do it safely. As always, this is general education. It is not diagnosis. If you have pain, sensitivity, cavities, gum disease, old dental work, or questions about whitening, talk with your dentist before starting. Before we talk about whitening, we need to talk about enamel. Enamel is the hard outer layer of the tooth. It is the part of the tooth you see when you smile. It protects the softer layers underneath. Enamel is very strong. In fact, it's the hardest substance in the body. Stronger than bone. Stronger than your willpower when someone leaves donuts in the break room. Well, maybe not stronger than that, but it is very strong. Even though enamel is hard, it is not alive like the skin or gums. If you scrape enamel away or dissolve it with acid, your body does not simply grow it back like a fingernail. That is why dentists care so much about protecting it. Enamel can be damaged by acid, grinding, hard brushing, abrasive products, decay, and trauma. Whitening is different from those things when done correctly. Whitening is designed to change the color of stains inside the tooth, not grind it away. How whitening works. Most true whitening products use hydrogen peroxide or carbamide peroxide. These ingredients do not work like a scrub brush. They work like a stain lifter. The peroxide moves through the tiny spaces in enamel and dentin and breaks up dark colored stain molecules into smaller pieces. When those stains are broken up, the teeth look lighter. That is important. Whitening is not supposed to shave enamel off. A properly used whitening gel is not a cheese grater for your smile. There are different types of whitening. There's the in-office whitening, where a dental team uses a stronger gel for a shorter time. There are dentist-made take-home trays, where custom trays hold the gel against your teeth. There are over-the-counter strips and gels. There are whitening toothpaste, which usually removes surface stains more than they change the deep color of the tooth. And then there are internet ideas. Some of these are fine, some are not. The internet can teach you how to fix a sink, bake bread, accidentally destroy your enamel in one afternoon. So be careful. Does whitening damage enamel? When patients ask, does whitening damage enamel? The best answer is approved whitening products used directly in a dental office are generally considered safe for many people, but overuse or misuse can damage enamel or gums. That means that dose matters, the directions matter, and your mouth matters. If someone uses a product too often, leaves it on too long, uses a high-strength product without supervision, or keeps whitening, even when the teeth are screaming, problems can happen. The most common side effects are tooth sensitivity and gum irritation. These are often temporary, but they still matter. If your teeth feel like they're texting you in all capital letters, pause and call your dentist. Enamel damage is more likely with overuse or harsh methods. Think of it like exercise. Exercise is good. Running 3 miles may be healthy. Running 50 miles in flip-flops because an influencer said it builds character, different story. Whitening can be safe, but whitening is not something to freestyle forever. Why teeth get sensitive after whitening? Sensitivity is a side effect people talk about most. During whitening, Peroxide can pass through the enamel and reach the dentin layer underneath. Dentin has tiny tubules or little channels that connect toward the nerve area of the tooth. When those areas get irritated, teeth can feel zippy, cold, or achy. This does not always mean the enamel is ruined. Oftentimes, whitening sensitivity is temporary. It may improve when you stop whitening, take a break, use a lower concentration, shorten the time, or use a sensitivity toothpaste. But sensitivity is also a warning sign. If you already have cavities, gum recession, worn enamel, exposed roots, cracked teeth, leaky fillings, gum disease, whitening may feel worse. That is why a dental checkup before whitening is smart. We can look for problems that could make whitening painful or unsafe. A whitening strip on a cavity is like putting lemon juice on a paper cut. The product is not the only issue. The open problem underneath is the issue too. What whitening can and cannot change. Whitening works best on a natural tooth and certain types of stains. It can help the yellowing from age, coffee, tea, wine, tobacco staining, and some everyday discoloration. But whitening does not work the same on everything. Whitening does not change the color of crowns, veneers, bonded fillings, or dentures. Those materials are like countertops. You can clean them, but you cannot bleach them a new shade the same way you can a natural tooth structure. So, if you have a crown on a front tooth and whiten the other tooth, the natural tooth might get lighter while the crown stays the same. Suddenly the crown stands out. That is not a fun surprise. It is like wearing one white sock and one beige sock and hoping nobody notices. Whitening also may not help fix gray stains. Several internal stains, fluorosis, trauma-related discoloration, or discoloration from certain medicines. Sometimes bonding, veneers, crowns, or other treatment may be the better option. This is another reason to talk with your dentist first. Whitening is not a one-size-fits-all answer. Whitening toothpaste is different from bleaching gel. Most whitening toothpastes help rinse surface stains. They may use mild abrasives or special polishing ingredients. Some may contain small amounts of peroxide, but most do not change the deep shade of the tooth the way that bleaching can. A whitening toothpaste can be helpful, but more scrubbing is not better. If you brush too hard with an abrasive toothpaste, especially near the gums, you can wear the tooth structure and irritate the gums. You do not need to brush like you're cleaning a grill after a 4th of July barbecue. Gentle pressure, a soft brush, and fluoride toothpaste are always the winners. If you want a whitening toothpaste, look for one that also protects against cavities and is safe for regular use. The ADA Seal of Acceptance is a helpful guide for products that have been reviewed for safety and effectiveness. The do-it-yourself whitening problem. Now let's talk about the do-it-yourself whitening trends. Charcoal powder, lemon juice, baking soda with random kitchen items, hydrogen peroxide swishing, magic social media hacks, banana peels, coconut oil, a tiny dance, and a moon phrase. The internet has suggestions. The problem is that many do-it-yourself whitening tricks are either not very effective, too abrasive, too acidic, or not well studied. Acid's the big concern. Lemon juice and other acids soften enamel. If you brush after acid exposure, you can wear the softened enamel more easily. Abrasive powders can also scratch or wear teeth if used too often or too aggressively. Your teeth are not bathroom tile. They do not need scoring powder. Some do-it-yourself methods may make teeth look brighter for a short time by removing surface stain, but they can increase sensitivity or damage the tooth surface over time. So my simple advice is, do not let your enamel become the test subject for a social media experiment. Who should be careful with whitening? Whitening is not for everyone at every moment. You should talk with your dentist first if you have cavities, tooth pain, gum disease, heavy sensitivity, gum recession, exposed roots, cracked teeth, lots of fillings or crowns on front teeth, braces, pregnancy questions, or a history of dental trauma. Children and teens should not start whitening because they saw an online trend. Their teeth and nerves may be more sensitive, and a dentist should guide the timing. People with white spots on teeth should also ask first. Whitening can sometimes make white spots stand out more at first. There are several ways to plan around that, but it is better to know before you start. If your teeth are sensitive before whitening, we want to understand why. Sensitivity can come from gum recession, cavities, cracks, clinching, acid erosion, worn enamel, or recent dental work. Whitening over a mystery problem is like painting over water stain on a ceiling without checking the roof. It may look better for a moment, but the real issue is still there. How to whiten safely. If you want to whiten, here are the smart steps. First, get a dental exam or at least ask your dental team. We can check for cavities, gum disease, exposed roots, and old dental work that may not whiten. Second, choose a reputable product. Look for the ADA accepted options when available, or use a dentist recommended system. Third, follow the directions. Do not leave whitening strips on longer because you think more time equals more sparkle. Teeth are not laundry. Fourth, do not stack products. Whitening strips, whitening toothpaste, whitening mouthwash, charcoal powder, and extra gel all at the same time is not a plan. It's a chemical group project, and nobody knows who's in charge. Fifth, take breaks if sensitivity starts. Sensitivity is your mouth saying, hey, please slow down. Sixth, use a fluoride toothpaste and consider a sensitivity toothpaste before and during whitening if your dentist recommends it. Seventh, manage stain habits. Coffee, tea, red wine, tobacco, and frequent acidic drinks can stain teeth or weaken enamel. You do not have to give up everything you enjoy, but rinsing with water and keeping good habits helps. Eighth, keep expectations realistic. Whitening can brighten teeth, but it may not create a movie star shade. Teeth naturally come in different colors. Healthy teeth do not have to be refrigerator white. In-office whitening versus take-home whitening. Patients often ask which one is better, in-office whitening or take-home whitening. Both can work. The right choice depends on your goals, timeline, budget, sensitivity levels, and dental history. In-office whitening is faster. It uses a stronger gel under professional supervision. This can be helpful if you want results quickly. Take-home custom trays are slower but controlled. The trays are made to fit your teeth, which helps the gel stay where it belongs and away from the gums. Many patients like this option because they can touch up over time. Over-the-counter strips can also work for some people, but they may not fit every mouth well if the strip does not cover the teeth evenly. Results can be uneven. The best whitening plan is the one that's safe for your mouth and realistic for your life. If you know you will ignore directions, definitely be honest. Your dentist has heard it before. How long does whitening last? Whitening is not permanent. That does not mean it's failed. Teeth are exposed to food, drinks, and habits every day. Coffee, tea, red wine, tobacco, dark sauces, and time can slowly stain the teeth again. Some patients need occasional touch-ups. Some do not. Depends on diet, habits, enamel, saliva, and the whitening method used. Think of whitening like washing a white shirt. It can look bright again if you keep eating spaghetti in it while doing karate. Eventually, it'll need another wash. Good brushing, flossing, regular cleanings, and stain control can help whitening last longer. When whitening is not the answer, some patients think they need whitening, but the real issue is different. Maybe there's plaque or tartar that needs cleaning. Maybe a tooth is dark because it's had trauma or a root canal. Maybe old bonding is stained. Maybe the teeth are healthy, but naturally a little yellow. Maybe enamel is thin, so more yellow dentin shows through. In those cases, whitening may not fully solve the problem. A cleaning, bonding, veneers, crowns, or simply a good conversation about expectations may be better. This is why I like to start with diagnosis before treatment. It's hard to fix the problem right, if we have not named the problem. A simple takeaway: does whitening ruin enamel? Not with proper whitening, used as directed in a generally safe manner. For many people, and it is not meant to remove enamel. But overusing products, using harsh do-it-yourself methods, whitening unhealthy teeth, or ignoring sensitivity can cause problems. The safest plan is to check your teeth first. Choose a trusted product. Follow directions, avoid internet hacks, and stop if pain or sensitivity goes up. Whitening should make you feel confident, not make your teeth feel like tiny lightning rods. At Wahpeton Family Dentistry, our goal is to take the fear out of dentistry. That includes helping your patients understand cosmetic options like whitening without scare tactics and without hype. Whitening teeth can be a nice goal. Healthy teeth should always be the first goal. If you think about whitening, ask us at your next visit. We can help you decide what is safe, what will work, and what might be a waste of money. This is Mason Haley with Wahpeton Family Dentistry. Thanks for listening, and remember, your enamel is valuable. Do not treat it like a science fair project.